everybody, and welcome to Healthy Hearts. It really is lovely to see you all again, and I'm hoping it's going to be a really interesting session as always. Both Dr. Alice and Dr. Hiba. We're going to talk about water and hydration and how important that is for all. For our entire body. So I'm really looking forward to this. And in preparation, I have my water here with me because I will be keeping myself hydrated as I try to encourage people to do throughout the session. So without any further ado, I'm going to ask Dr. Alice to continue. Thank you so much.
Mm-hmm. Good evening, everybody. It's always nice to be here and to talk to people about health. It's my passion, and I think we have a lot of people who join me in this passion. I will just share my slides right now. So my name is Ojuang, like you said, and together with Sahara Africa, we bring you Sahara Nutrition. We bring you this session on hydration. So before even we go into hydration and define what hydration is, we want to just remember the 7 natural doctors. These are some of the things you need to be doing before you even start to get consultation for nutrition. So the first one is sunshine. We all need sunshine. We need fresh air. We need exercise. Remember one of my favorite sayings from before? If you can't make time for exercise, be ready to make time for illness, by Earl of Derby, 1873. And water is one of the natural doctors. So if we are not doing our water intake, then there's a serious problem. It means we are not just doing all the 6. So we also have diet as a natural doctor, your rest and laughter. And when you talk about diet as a natural doctor, it means that we need to eat healthy and natural as possible. So anything that's not natural, we want to run away from it. So today we are going to spend time talking about hydration. So what is really hydration? Hydration is this process of causing something to absorb water. So causing something to absorb water, in this case, we are talking about you and me, the human being, your body, your organs. So how often should you take water? Most of the time, I know some people take water in the morning, at lunchtime, and in the evening. So they take breakfast, they take water with a meal. That is very few times in a day. But I'd like you to answer these questions once we've considered a few things, a few reasons why we need to take water. Then we can go back and discuss how often should you take water. So what are the reasons why we need to drink water? Number 1, water lubricates your joints. So you need water for your joints to be lubricated. Remember how many joints we have? We have joints in your foot. Let's say in the lower limbs, we have down somewhere near your ankles, we have your knees, we have your hips, we have your waist, we have your shoulders, we have, fingers have many joints, we have your wrists, we have your elbow. And you can imagine how many joints that we have. Maybe Hiba find out how many joints that the body have so that we can be able to appreciate how much water we need to take. So that's the first reason why we should take water. It forms saliva and mucus. You need saliva so that your mouth, your lips, they don't stick together. You need mucus to lubricate various parts of your body. And mucus is also, it also protects your body. It also stops microbes from getting into the system. Let's just make it simplify. Let's just simplify and say that. Of course, if mucus is too much, then it makes you not, you can't even breathe and you can't get sufficient oxygen and you have a chest thing. But it forms, water helps to form saliva and mucus, and all these are necessary for good health. It boosts skin health and beauty. So if we want good health, we want glowing skin, we need to drink water. So you cannot have good skin without water. It means that you might have to invest in very expensive products for you to even achieve this. It cushions the brain spinal cord, and other sensitive tissues. So remember, your brain, you need it for so many functions, and the brain is the one that controls your body. It controls all the nerve endings, everything. Your spinal cord supports you completely, and all the sensitive tissues. So this is what makes you as a human being. So you need water for these functions. Most of the time, people just think water is for excretion, but water is for a lot more other things than just these ones. We're still going on. Yeah, so water, it also regulates your body temperature. It flushes the body waste, and this is what we know. And it helps maintain blood pressure. And last but not least, the airways need it. So those are 8 reasons actually why we need to take water. So the function of water is so important for you to have good health that we need to make sure that we are actually drinking water. Now, the question here is, how often do you need to take water? Let's go back to before. How often should you take water? I'd like some participation.
I'd like to say every 15 minutes or so we should be sipping something.
Mm-hmm. Yeah. Thank you. Karen? Hiba?
So I have started something to help me drink more. So every 1 hour because I sit a lot when I'm working, so I kind of have an alarm. So every hour it's for me to get up and take a walk, and then I can sip. So I do it hourly over the 8 or 10 hours that I work during the day.
Yeah. So actually, water, so your body needs water every second of your life, every single second of your life, because you can just see, you've seen what you need to do. It lubricates your joints, right? It forms saliva and mucus. It boosts skin health and beauty. It cushions the brain, it cushions your spinal cord and other sensitive tissues. It regulates body temperature, flushes your body waste, and it helps maintain blood pressure. So you need water every second of your life. So you cannot take water in the morning and in the evening, in other words. You need to do what's realistic. So what's realistic is usually, at least assuming we are taking maybe 2 liters of water in a day, so which is 8 glasses of water. So in the morning, between the time you wake up and 10 o'clock, maybe you've taken 500 ml. Between 10 in the morning and maybe 2 in the afternoon, you've taken another 500 ml. Between 2 in the afternoon and 6 p.m., you've taken 500 ml. Between 6 p.m. and bedtime, you've taken another 500 ml. So every 4 hours you need to take. So you can divide how you use that. Of course, you need to be realistic so that you're not always, walking back and forth to get water. There are many reasons why some people don't take water. I see some of my clients say, oh, I'm going to keep peeing all the time, and so I can't take water. No. If you don't take water, if you don't normally take water and then you start taking water, you will definitely get going to the bathroom because the body is so excited. It is flushing out the waste that it needed to have done many, many months ago. So yes, you will find that when you start taking the water frequently, you'll go to the toilet so often. But when you start to manage your water intake and make sure you're having in a day, you're not going to be rushing to the toilet every few minutes to pee because you've taken water. The body, you can train your body. The body can adapt to any situation. So we need to take water. Of course, when it comes to how much water should we take? So how many glasses? We just gave an example, but it depends on your age because a young person, a teenage 10-year-old cannot take 8 glasses of water. So really, it's calculated according to the age of the person and according to your gender. Men, the same weight as me, more because they're more muscular, they'll always tend to need more water, and their body processes is always different from ours. And then the metabolic state, meaning that let's say somebody who's hypermetabolic state, when you are exercising, depending on the kind of exercises you do, they need a lot more water. Like if I've been in a camp where they're training athletes to go on for a run, and they actually we have to follow the rules by the book. So they are running, they have to take water every 500 ml every hour because they sweat so much and they lose so much fluids. So, and of course, if somebody is hypertensive, then sometimes depending on their kidneys and what they are taking, if they're taking diuretics, they probably need to take their normal water intake. If they have a kidney problem, sometimes their water intake might be limited. So if you're not well and having certain conditions, you have a heart problem, heart failure, then your water intake will change. But when it is normal, between me and you, 1.5 to 2 liters. And then when you sit, the whole day you sit in a lit room where there's lighting and heat, then you lose actually a lot more fluid, and you need to add another 500 ml on top of your 2 liters every day. So water, water, water. Yes. So at this point, maybe we can have some discussions about water and questions, and then I will give you my punchline.
Yeah, so there's a question I wanted to read, Alice. So someone is asking, can you take 500 ml once? That's
okay.
Glasses at once.
That's a good question. But let's go back and think about how much water do you need in a day? So if you need 2 liters in a day, you need to actually distribute this very well throughout the day so that every second your body is getting water and you're not staying like in dehydration state for like 6 hours. So I would say you may not take 500 ml in 1 hour if you want to balance your water intake through the day. But yes, it's possible. Usually when I come from a run in the morning, I will take 500 ml like this, 2 glasses. It will just go down. So it's not bad. You can do it. It's okay. There's no problem. Yeah.
Yeah, and just for those who might not, not everyone is familiar with the mils. So that's 2 glasses, 250 ml is just one medium-sized glass. Am I right, Alice?
Yes, most glasses are actually 200 ml, but some are 250 ml, a little bit larger. So that's like just 2 glasses of water in one sitting. That's 500 ml. That's what she's saying.
Yeah.
Yeah.
So another question that comes to mind is not here. Is, for people who struggle to take water, can they replace that with fruit juice, unsweetened fruit juice, or soup?
Very good question, I must say. I get that a lot. So remember, water is a natural doctor, meaning it's natural. We found it. It was provided the same way the sun, oxygen is provided. It's natural. So then in that case, your soup does not meet that criteria for a natural doctor. Your juice does not meet that criteria for a natural doctor. So water can be paired to oxygen. You're not going to contaminate oxygen so that you can have it. You're going to have it like this. So the other thing about water is when you take water, it's used for all these functions, like for excretion. Let's take an example. When you take water, it's going to be used for many functions, but let's take an example of the excretion of waste. So you take water, your kidney is going to use it, and it's going to excrete waste. But when you take juice, first of all, the body has to separate the solute from the solvent, okay? Remove the juice and separate the juice and water, and then is when it will use the water. So you're adding processes rather than just taking water. So my advice is take quality water, count 8 glasses, and if you want to have a glass of juice somewhere along the way, that's fine. So I do not recommend all these things in the market, like, put a little, sometimes you can put a little lemon in your water to taste, no problem. But can you do that every day? Because also when you take just lemon every day, that eventually adds up to having acidity. So just learn to take quality water. without any additions. It will benefit you a lot more than taking anything else. When somebody is sick and they have limited their water intake, then they can take it in form of, so we will count their intake as fluid rather than water, because they need a certain amount of fluid. So we have to make sure that they're also getting other nutrients so that they're not so limited. So then we say fluid. We can allow them juice, we can allow them soup, but me and you, let's just take the plain natural water. Thank you.
Natalie has a follow-up question.
I just wanted to know about the 2,000 milliliter of water a day. Can you just take 5 milliliter in 4 hours, just once? So you get the hours, and then after another 4 hours, you get another 5 milliliter of water. So that can be divided by 4 times a day. That's what I want to know. Or you have to divide it like 100 milliliter every day, an hour or 2 hours.
Okay. Thank you for your question. Okay, there was a bit of an echo, so I'm not sure if I got everything, but I'm just going to try. But you're saying, can you take water all at once, or you have to distribute it? Or Hiba, did you get the question? Can you repeat it for me?
I usually take that 5 milliliters once, and then after maybe 3-4 hours, I take another 5 milliliters. Well, I don't know if they're right to take that. Like
Yeah, that's fine. That's part of distributing, because you're distributing through the day. So instead of having 250 ml, so 1 hour you're having 500 ml. That's fine. That's perfect.
Okay.
Yeah.
Okay, thank you.
You're welcome. Yeah.
And then Rahmat says, is it a good habit to have water by your bed and drink during sleep?
Well, you need your sleep. So why are you sipping water during sleep? But sometimes, especially the seasons when I'm at my best running, let's say my running season, I always find that I'm really thirsty at night. So I have water. And so sometimes I actually find that I have to, my throat is very dry, and then I wake up and drink water. So, and of course, whenever I do my assessment, it means I didn't meet my water intake for the day, because when I run more, then I need to drink more. So, but so it's okay to drink water, but what I'll be worried about is, are you getting sleep, or are you interrupting your sleeps too many times? Yeah, but it's okay to have water by your bedside so you can sleep.
When you take medication, should you take extra water?
Very good questions. There are some drugs, whenever you buy medication from the pharmacy or you're given a prescription, it is very important to check how much water you should use and the side effects of the medication. So a lot of these drugs are excreted. The waste is excreted through your kidney. And if you don't take, there's some which clearly indicate take with a lot of water. So if you don't take with a lot of water, they can actually damage your kidneys, especially diabetes medications, heart medications, blood pressure medications. So yes, you should not take your medicine with that tiny little water like a lot of people do. You need to take it with a full glass of water. If you're on medication throughout, you need to make sure that first of all, meet your water intake plus an extra glass to swallow your medicine. Very good question. Thank you.
Some more questions before your parting shot. I'll read them together. So, any tips on how to increase my water intake by Kadi? And then the last one, do males and females require different amounts of water?
Mm-hmm. I think we still have time.
We still have some time, okay.
Yeah, so the first one was, what are the tips to increase your water intake? I think the first thing is you need to remember, why should I take water? If you're always having crackling joints, you're always tired and fatigued, because if you don't take enough water, you will be tired and fatigued. If you don't take enough water, even you cannot, they say your circadian rhythm is interfered with. Circadian rhythm is your day and night rhythm. You end up, when you go to sleep, you take a very long time to actually get into the rapid eye movement. While the other person who's well hydrated falls into bed, 15 minutes later, they are gone. So it's important to take water. So one of the ways of improving your water intake, you have to meditate on 5 years from now. What do you want? Good health, nice skin, or you're just going to go by? You're just, like your life just goes by. So that should be one. Reasons why you need to take water. Think about those. And secondly, I mean, it's been given to you naturally by your loving Father, Jehovah God, So, or Allah, if you wish, just take it. Just make an effort. The same way you need oxygen is the same way you need water. It's only that when you don't have enough oxygen, you feel the consequences like right now, like immediately, and it's scary. But when you don't have enough water, the effects take longer, but they will be deadly at the end. So just meditate on why you need to take water. Talk to yourself and tell yourself you need to take water, and then use a diary. There are apps that you can actually use that reminds you to take water. If you need help with that, I know a lot of people need help with that. So get an app to remind you to take water. Put it on your computer, put it on your phone, and then just make an effort when it reminds you, take the water. Within a very short time, it becomes a habit. And there you go, Yep.
Having a cup of tea or coffee, does count as your water? It's a question. Does it count?
I think, Hiba, you want me to say it counts. No, it does not count. Coffee, juice, soup does not meet the qualifications of natural. Natural doctor. Water, oxygen are natural doctors. Laughter is a natural doctor. So coffee, those do not count as your water. They count as your total fluid intake for the day. Yeah, I see you have water, Iba. Good job.
Yeah. What if you have heart issues? How does water impact on arthritis? So those are two questions.
Mm-hmm.
Heart issues and arthritis.
Okay, so heart issues, sometimes when you have, you have enlarged heart or heart failure, when you take water, you get into some form of distress, and maybe Karen with her nursing, she can explain to us. So sometimes your water intake is limited. So we need to know exactly what heart problem the person has, so we can actually recommend. Sometimes they might have heart problem with a high blood pressure, heart problem with few medication, heart problem with a lot of medication. So then we need to classify so we know where they fall, and we can recommend fluid intake accordingly. And the other one was arthritis. What's the effect of it on arthritis? Yeah. Remember, one of the reasons why you must take water, one of the major functions of water is to lubricate your joints. Arthritis is a condition that affects your joints. If you're dehydrated, you will experience more pain for your arthritis. You will take more painkillers, and you will take more medications to try and manage it. So if you have arthritis, number one, your water intake should be like 100%. Then if you're still having some pains, then the doctor can sort that out, but you're eating healthy, you're sleeping, you're hydrating. Thank you.
Okay, lemon has alkaline effect on the blood, even though it is acidic. Is it therefore okay to drink lemon with water regularly? I think you already touched on this. So it's a similar question. Do you suggest adding things to water like lemon, filtered water over tap water?
Okay, so no. So if I'm your dietitian, please know that I'm not going to recommend juices, coffees as part of your water intake. I recommend to take quality water, because when you take juice or coffee, your body still has to separate the solid from the solvent, and it's not using the water that it's not using water like it's supposed to. Also, when you take coffee is a diuretic. You end up losing a lot of fluid. So the more coffee you take, the more dehydrated you actually become. But because it's a habit, people don't realize that. So count 6 glasses of water, then you can add your coffee and your juice on top of that. Thank you.
Karen,
how much water should one have with chronic kidney disease? I think that's really important, because unfortunately there are too many of us that suffer with that. So, in our community. So I think it'd be really great if Dr. Alice could answer that question.
Mm-hmm. So when you have a kidney condition, we have to think about So this is now going to get a bit complex. Glomerular filtration rate. So what is the rate at which your kidney has failed? There's a certain number that's allowed. So where is it at? So we usually have to check that. So with me, I just need to get that information from the doctor, and then I'll know that you have limited water intake or you don't have. Patients on dialysis, their water intake is also limited, but during dialysis, their water intake, before dialysis, they can increase their water intake.
Yes. Can I just ask about that? Otherwise, Rahmat will kill me. Containers in which we store water, plastic, metal, and glass, which is best?
Very good questions. I discovered something a few years back. I just went in for some plastic session, and they said, you see, like the water bottles that we buy the water in, Karen, like the one you're carrying today, it's actually written how many, it's written, there are two different numbers, the type of plastic and the number of times you should use that bottle. So most of the time it's written once or twice. So you can't use it more than that. So if it's light plastic, the ones you buy the water from the bottle, then you need to use it once or twice, and then that's it. You can't use it again. But then there are specific water bottles. There are specific bottles that are made for water. Like heavy plastic is fine, metal is fine as long as it does not rust. Glass is even better. Yeah.
That's great. Alex. Thank you so much. Iba, did you want to say something?
Not
so I cut it short. Taking drugs without eating properly is like washing your hands and drying them in the dirt. So if you're especially on any chronic medication, just make sure you are doing the natural part, your 6 natural doctors, your sunshine, your oxygen, your water. And then we can say, okay, these ones are being done. So you don't have to be sent to the nutritionist. And then I tell you, I think your biggest problem is hydration. Go away. I've charged you £100. Go away for 2 weeks, hydrate, and then come back. Let's discover something else. So those you should do before you come and see us. Yeah. Thank you.